Yes, Namaste. I'm Dr. Yogesh Patil, the founder and director of Yogium Hospitals. And it has been a great experience spending time in this interactive technology, surgeons of the country, trying to get robotics and robotic surgery into the normal way of doing the total knee replacement. So it's a assistance that will definitely help the upcoming generations, wherein the technology will be used more for the benefit of the patient's successful outcome post total knee replacement surgery. So we have got a lot of clinical benefits after doing robotic assisted knee surgeries. The most important clinical benefit is the faster recovery of the patient that we see. Within a few hours of surgery, patient is able to stand. Post-operative, patient starts walking a few steps with the walker, and we have seen that within 24 hours the patient independently walks without any kind of a support. Because the damage to the soft tissue is less and the implants are placed with sub-millimeter accuracy, these benefits gives an excellent outcome, excellent clinical outcome. Even the excellent functional and clinical kinematic alignment of the knee is good. So the range of motion that the patient develops as compared to the normal TKR, I have observed that the flexion is very much faster in the robotic assisted total knee replacement surgery. Within 2 to 3 weeks, patient is able to sit even cross-legged, and within a month they start to climb stairs, do their activities like driving, even going to swimming and going for long walks. So these are the amazing clinical benefits. More importantly, there is a less pain that the patient experiences during the procedure because of the less damage to the soft tissue. And if the pain management is excellent, then patient has a very good personal experience and a painless journey after a total knee replacement surgery. So these are the clinical benefits that I have observed in my practice. Robotic surgery is the future. 5 years from now on, I definitely see robotic surgery being a very common way of doing total knee replacement arthroplasty surgery. And I also see that the development will not be only limited to a particular surgery like a knee replacement. It is going to get advanced and it is going to extend to the other subspecialties of the knee replacement surgeries and other subcomponents like the other friends of the arthroplasty, like it might go into the spine surgery. It will definitely come up into the arthroscopy surgery. The robotics will help that. It will already the robotic assisted hip replacements and robotic assisted partial unicompartmental knee replacement surgeries have also become a part of the robotic surgery. So robotic surgery 5 years from now on is not only going to be limited to the arthroplasty field, but it is going to extend its hand in all subspecialties of orthopedics, including arthroscopy, spine surgery, even trauma surgeries will be done with the help of the robotic surgeries.